So as you may know, the rates of COVID-19 is increasing within the community. And as individuals are more concerned about their status, they may be availing themselves or trying to access testing. So the demand for testing has gone up. There are a lot of things that may be driving the demand for testing. Some people think that, again, if they're under quarantine and they get a test, they'll come out of quarantine earlier. Currently, according to the guidance, that is not the case. That may change. Some people may have heard that CDC is working on changes to their guidance, and that may involve testing as a means to shorten quarantine. But right now, if you're in quarantine, testing is not a methodology to get out of quarantine. The other things that we have heard in the health department is that travel is one of the biggest drivers of people accessing testing, not only in terms of returning from a trip abroad or within the other parts of the United States, but individuals are availing themselves of sporting events, traveling for their children's sporting events, and returning and accessing testing. When you compare what's going on with regard to testing now as opposed to earlier in the pandemic, there are a lot more tests that are being done daily now than it was at the beginning of the pandemic. So the availability of testing is significant, but the timeliness may lag. Individuals who may want a rapid result of a test may not be able to access those, especially if they're asymptomatic. And they may be getting a PCR done. And as the demands are putting more strain on the commercial labs, the turnaround time also may be increasing. As the demand for testing has increased, it's placing a burden on our health system. And what that means is hospitals, emergency room departments, large medical groups, they're not solely taking care of COVID, they're taking care of all these other cases. And what they want to make sure is that they're not mixing populations or introducing COVID into their system. So they need access to testing, especially for their patients and symptomatic patients. So what they may be doing is putting in policies and protocols to sort of focus their supplies and their testing capability to their population and symptomatic individuals. So people who are asymptomatic and who may want testing for things like travel, for things like coming out of quarantine, and for other reasons may find it a little bit more difficult to access it on a timely basis. And testing is a critical part of the overall response to the COVID-19 pandemic. But I want to let people know that, again, the critical thing is if you are symptomatic, quarantining and isolating yourself is the number one advice that I can give you. You could contact your provider in terms of accessing testing, but if you're symptomatic, trying to access tests on a timely basis may be difficult. So it's critical that if you're symptomatic or have been exposed to someone with a proven case of COVID, that you isolate yourself.